Hi, I'm Dr. Heather Dirkmaat, and I'd like to share some observations that I've had regarding ear infections. Now, as we're coming into the cold and flu season, we do see an uptick in these infections. And why? It's because usually when we have these upper respiratory infections, it causes a lot of pressure. And so whether it's viral or bacterial, it causes a lot of pressure behind the ears. We can get a lot of fluid, and then that's how we get these ear infections that develop. Now, some kiddos seem to get more than others, and that's a whole different story because that can be genetic. That can also be just craniosacral, the alignment of the ear canals. It can also be allergies too, believe it or not. If you have a family history of allergies, your kiddo might have allergies, and that's allowing a lot of fluid to build up too, because not only do allergies manifest in the eyes where you see the watery eyes or the nose, you can also have allergies in the ears where you have your ears weep, and it's creating a pool of that fluid in there, and it just builds up, and then also we get those ear infections there. So a lot of the people that I see and treat, they don't want to go to antibiotics. In a lot of offices, that's their first line treatment is, hey, you got an ear infection, we're gonna put your kiddo on amoxicillin. And yeah, they've already been on amoxicillin like 6 times this year because they've already had 3,000 ear infections. And so we don't want to keep giving rounds and rounds of antibiotics because that's not great either. And sometimes when I look at kiddos' ears, I can see that they're not quite there. They just look like they're starting to develop that ear infection. We got to get on this. And so how do we do that? And a lot of times some of those methods are going to be that garlic mullein ear oil that we're putting in there because garlic is really, really great antimicrobial. And so it's safe and it's easy and it alleviates a lot of that pain for that child, and it's going to help fight the infection. Now, recently I had a couple discussions with some parents that, of course, you always hear the worst story. Oh, this family down the street, they put it in their kid's ear and now they can never hear again. And it's like, well, that is because the kid's eardrum burst and then they kept administering this. So you're always going to hear the worst stories. But really, that is an outlier. That doesn't normally happen. And of course, if you're actively seeing a good doctor, you're monitoring the status of this infection and seeing how it's going. And of course, if it gets to a certain point, sure, let's go ahead and start some antibiotics. But until it gets to that point where it's really severe, why don't we try the natural approach and not give the kid that's going to disrupt the whole gut biome unless we have to. Let's start something that's more natural initially.